Okay. Hi there. This is just an update on breastfeeding. Really, you could spend years studying breastfeeding and becoming a breastfeeding expert. And there are also breastfeeding doulas. Um, and most nurses on mom baby are pretty well versed in breastfeeding. Then also, they usually have lactation consultants who will help the moms. They see all the moms, but then they really help the moms with who are having trouble, and they can diagnose problems and help the nurses find interventions. So we want to know about infant hunger cues. Um, we'll talk about latch scoring, which you guys will have to do, um, and knowing how much the baby's getting, which is a huge concern for moms. There are different positions. And then knowing how to hand express breast milk is something every mom who's breastfeeding should be able to do. And then a few troubleshooting things. So hunger cues, if they're awake, if they're awake and before they're crying, that definitely tells you that they may be hungry. And actually, the best time to put baby to breast is when they're in a REM sleep, so you can see their eyeballs moving underneath their eyelids. That's a great time to pick up a baby and just kind of snuggle them, put them skin to skin, nipple to nose, tummy to tummy, and start that. Rooting around, you know about the rooting reflex, but if you see them kind of rooting, turning their head and having their mouth open, looking for that nipple, looking for the breast, that's something. If they're sucking on their hands or making sucky sounds, that's another one. Crying and thrashing are late signs, and rarely is breastfeeding going to be successful unless we calm the baby down before we try to get them latched. This is the latch score. This is the latch score sign. You just read it across. Um, so if you walk in and mom is already breastfeeding, you can ask, how did the baby get on right away, or did it take a little while? But can you hear audible swallowing? Do you see the rhythmic sucking? And you see that in the back of kind of at the where the mandible joint is. You can see in the sort of in the back of the mouth, there's rhythmic sucking. And then the type of nipple mom has, is it inverted, flat, or everted? And then how comfortable mom is she's having a lot of trouble? Is she engorged? Are her nipples cracked and bleeding? Do they have blisters or bruises? Or is it little? Do they just have their breasts are starting to fill? So they're just getting a little harder and bigger. Or is it reddened? But something that they would describe as moderate to mild discomfort. Soft and non-tender is a score of 2 then. And then the hold. Do we have to hold the infant at the breast? And sometimes you have to do that after mom's had a C-section, or if mom is trying to nurse twins at the same time, they need quite a bit of assistance. Minimal assist is you elevating the bed, putting the pillows, getting mom all situated and sitting up. You would teach one side, mom does the other, or the staff holds and mother takes over. And then a latch score, a 2 in that category would be no assist from the staff, and mom just puts the baby to the breast by herself. So you can see latch score of 10 is perfection. And latch score of less than 7, we need to be implementing interventions, and we need to teach, we need to document those interventions. So there is a YouTube to see on the latch, what a latch looks like. And what we really want to see, nipple to nose, we want the mouth to be open. Um, and if the baby needs to be adjusted a little bit, you would move the baby. You don't move the breast in the baby's mouth. If the baby doesn't have the whole areola in the mouth, or if it's uncomfortable for mom, we need to stick our finger in the corner of the baby's mouth, break the seal, and just start that latch all over again. And then we should hear audible swallowing. Significant other, if baby's really sleepy, and in the first 24 to 48 hours of life, babies tend to be sleepy, and sometimes it's hard to wake them up to feed. But the significant other can tap the baby's feet, rub the baby's back. Sometimes we'll put a cool cloth on the baby's face to wake them up a little bit. Okay, the types of nipples, and we'll see that during the bubble he assessment. So normal sticks out, that's considered everted. A flat nipple, you just have a very little bit sticking out. And inverted, it actually goes in the main opening. It's actually concave there. So we do have some different tools to help pull the nipple out. Um, and that mom can wear in between or just before she starts nursing. And then a plastic nipple shield that goes over the nipple. And actually, it's just like kind of a small version of the nipple that's on a bottle. Okay, so comfort, you we assess, we talk about engorgement, and we tell moms about the interventions. And again, we check the nipples. And what can we do if those nipples are cracked, red, or tender? One of the things that we have is we need to teach her how to have a better latch. We have cooling gel pads that moms can put on their nipples in between feedings. They can keep them in cold water in the fridge, and then they're very cooling after mom nurses. We have lanolin cream that has natural oils. It's actually from sheep. Um, and moms can put that on their nipples. They can actually nurse nurse over lanolin cream. It doesn't hurt the baby if the baby gets it in its mouth, but some babies don't like the taste, and so they can gently um, wipe the lanolin off before they feed. Moms want to, when they wash their nipples, they shouldn't use any soap. And after they finish nursing, they should express a little milk and rub that breast milk into the nipple. That is very soothing, and it has anti septic qualities. So it will help heal that nipple. So that's one of the best things that they can do. And then these are some of the positions, and you can see a couple of YouTube videos about breastfeeding. Um, this side lying is really nice if mom's a fresh C-section. This where you have the baby on the tummy, actually they can do that right away after delivery. That baby can, because of this something in the amniotic fluid and the smelling the mom's milk, they will do a little breastfeeding crawl. And I think you have that in your, we have that in one of your weeks, the newborn week of, week 5, yeah, week 5 in 5:45 class. I think there's a video about that shows the breastfeeding crawl, but within 30 minutes, you can have it low on the abdomen. Within 30 minutes, the baby will crawl up and find that nipple. So, okay, breastfeeding frequently. You can't breastfeed too often when you're trying to start out. You want to get that baby to the breast at least every 2 hours. I would say you would want to offer the breast. An attempt will actually increase the baby's blood glucose, even if they don't suck too much. And colostrum is not, that's that first golden milk that we have that has all of the wonderful immunity properties. It has laxative properties, so it really helps their meconium plug to flush through. That is, doesn't have a lot of volume to it. So breastfeeding is really a good idea. Breastfeeding often is really a good idea. And again, the milk supply is supply and demand. So the more the baby nurses, the faster the milk will come in, and you'll have enough milk to feed the baby. You want from the beginning at least 10 to 12 breastfeeding sessions in a 24-hour period. As baby gets good at it and older and has a stronger suck, you won't breastfeed quite as often, but in the beginning, you need to be frequent. Feedings can be anywhere from 10 to 40 minutes. Even a little bit is an attempt. We ask mom to keep track, and they they shouldn't stop a baby who is nursing. So let the baby nurse until they relax and open their mouth and the nipple falls out of their mouth. Then mom can cuddle the baby, maybe pat its back for a few minutes, possibly even change a diaper, but and then put the baby, put the baby to rest on the other side. And mom should offer both sides for every feeding. So signs baby's getting enough. They're gaining weight, but that is not immediate enough for most people. The best way to know that baby's getting milk is that they hear audible swallowing when they're breastfeeding. Then they know they're getting fed. If babies have the appropriate number of wet and poopy diapers, that's another way. And then the fact that the baby's content in between feedings. If it wasn't content, we'd be trying to feed them more and wondering what's going on. So a sleepy baby, you want to, and I would say you always want to, especially when you're starting breastfeeding out, you want to unwrap the baby and have mom naked from the waist up, and you want to put them skin to skin. Skin to skin, if you're trying to encourage breastfeeding, keeping them skin to skin where the baby can just find that nipple whenever they want. It's a really, really, really good idea. If the baby's crabby, unwrap the baby, put them skin to skin with mom. If the baby can't hold a latch, they may have a frenulum that is too long, or they may have a lip tie or a tongue tie. And we may have to look at getting different tools or having a physician kind of snip that tongue tie. Mastitis, we talked about that in boot camp. So yeah, you feel like a Mack truck has hit you. You guys know about that. So when you're watching, you're going to obviously look at the components of the latch score. And if you have a clipboard, you can take a clipboard with the paper in with you and kind of look at stuff, look at the things. You don't have to have it memorized, but you're going to watch for that back jaw movement, listen for swallowing, ask mom if she can hear swallowing, and and then watch for those satisfied signs of a satisfied baby. You can see this baby's mouth is still open. They're totally just relaxed and asleep. And that's a happy baby right there. This is the chart from your book. And again, you read across and score with 1, 0, 1, or 2. And then I will you need to complete this latch score. So baby is fussing. Nurse assists with positioning, holds baby's head, and places the pillow for mom. The breast is soft. There's a little redness on the left nipple. The baby latches but falls asleep and needs coaxing to suck and swallow. So you decide what that latch score is by looking at the chart. And you can tell me. Thanks.